Antidepressants are life-changing and incredibly powerful for many people who deal with mental illness, especially depression, of course, but also anxiety disorders. There's little doubt that the suicide rate would be far higher and the overall well-being of the human species would be far lower if these drugs did not exist. However, accidentally taking too much of these drugs can have confusing, painful, and downright terrifying results for the person experiencing it, and it can sometimes be fatal. In this video, I'll describe one of these conditions called Serotonin Syndrome, and we will see how even if you're not taking antidepressants, you may still be at risk of serotonin syndrome. We'll look at the symptoms, both mild and severe, how serotonin syndrome can be differentiated from related toxicological conditions like neuroleptic malignant syndrome, the biological mechanisms behind serotonin syndrome, the drugs that cause it, who's at greatest risk of developing it, how to avoid it, and how doctors usually treat it. Just so you know, and I linked it in the caption, but this video, I'm relying mainly on a 2021 article by Gordon and colleagues published in the academic book Movement Disorder Emergencies, Diagnosis and Treatment, which is published by Springer Nature, Switzerland. So if you want to learn about this condition and about how your brain works in the process, then stick around. Hey, what's up? I'm Andrew, and this is Sense of Mind. This channel is all about giving you the tools so that you can upgrade your mind and improve your life. It's all about giving you fundamental neuroscience, basic science, psychology, critical thinking, mental health. We talk about all of that. So if any of that is interesting to you, definitely subscribe or follow this channel if you're on YouTube or Instagram, respectively. Please like this video and give it a comment if you have any thoughts. I'm really excited you're here. Let's get back to it. Okay, so this current video is the first in a mini-series focused on the neurotransmitter serotonin, which is also known as 5-hydroxytryptophan or simply 5-HT. This first video will introduce you to this very important neurotransmitter by examining how problems in the serotonin system, namely too much serotonin, can lead to serotonin syndrome. And that'll also tell us about what the system does in general. All right, and then the next video, the second in this serotonin mini-series, will be dedicated to the overall neuroscience of serotonin and its roles in various behaviors and cognitive and emotional processes. The final video, the third in the serotonin mini-series, will turn to how you can naturally stimulate serotonin release in your own brain and whether that's something you should want to do or not. So my goal with this series is to really give you an overview of what serotonin is all about and give you some tools on how to think about it, how to avoid problems with it, and maybe even how to increase it. And this mini-series is part of a larger Introduction to Neuroscience series. In all the topics in this Intro to Neuroscience series, there are usually 3 levels of difficulty. So level 1, which is a 1-minute overview of the main points. Level 2, which is usually around 10 to 30 minutes and has more technical details. And level 3, which is about 20 to 40 minutes and has even more detail and technicality. However, sometimes, as with this video, there will only be 2, the level 1 1-minute overview version and the longer version, which is this one. Now I do that sometimes because I think it just works better as a cohesive whole and it might not be any harder in the level 2 versus level 3 version. Okay, first off, let's look at a hypothetical clinical vignette of what serotonin syndrome is like. Let's say you're 22 years old and about a year ago you began taking Prozac, which is an antidepressant SSRI drug, after your psychiatrist prescribed it, of course. In that time, you noticed a marked improvement in your mental health and well-being. You consider yourself lucky because many people who start antidepressants have to try a few before finding one that actually works without major side effects. But tonight, you and some of your friends decide to go dancing at a club. When you get there, you avoid drinking too much because you know that alcohol can have bad effects when it's mixed with your medication. But about halfway through your night, one of your more adventurous friends offers you some MDMA. Now, that's a party drug that's sometimes called Molly, and it's the active ingredient in ecstasy. At first, you hesitate, But you decide that since you tried it a few years ago and it was a good experience, you might as well do a little bit tonight. At first, you don't notice much except a little bit of excessive sweating, which you remember from the first time you did it. But after about an hour, things really start to go downhill. Everyone else in your group seems to be doing fine, but you're feeling really agitated, sick, and confused. You have difficulty walking straight, partly because your leg muscles seem to have small spasms every now and they're cramping up a bit. You feel hot, your heart rate is elevated, and soon you start to feel pretty nauseous. Noticing that something is clearly wrong with you, the designated driver in your group decides to take you to the hospital. He explains to the doctor that you took some Molly earlier in the night, but that you didn't drink, and that despite taking the same dose, nobody else in the group is feeling ill. After calming you down, the doctor manages to ask you some questions. She soon realizes that you are likely experiencing serotonin syndrome. She determines that it will very likely go away within the next 24 hours by allowing the MDMA to clear out of your system, but being worried about your muscle spasms, she gives you a light sedative which also helps reduce your elevated heart rate and your body temperature. Additionally, the nurses give you an IV drip of water and they try to cool down the room a bit. About 6 hours later, you feel relatively normal again, but with a newfound caution regarding pharmacological interactions. The next time you speak, you and your psychiatrist have a long conversation about why taking drugs like MDMA is so dangerous for you. And that is something for which you no longer need any convincing. Your doctor explains that your antidepressant increases the amount of serotonin in your brain to a higher but still healthy level. MDMA similarly elevates serotonin along with dopamine and noradrenaline, two other neurotransmitters, and the combined effect leads to dangerously high levels of serotonin and thereby induces serotonin syndrome along with all the symptoms that you were experiencing. Okay, back to reality. What we just went through was an entirely hypothetical case of a patient with serotonin syndrome. And as a caveat, though I based it off of real case studies and from my reading of the clinical literature, the precise treatment, time course, and other details may not be representative of similar cases. Anyway, there's a lot we can still learn from this vignette about what serotonin syndrome is like for those experiencing it. Not only that, but the particular symptoms that arise also tell us about what the serotonin system is doing in the healthy brain as well. That is, because serotonin syndrome is caused by unnaturally high levels of serotonin in the brain and body, the symptoms it causes show us some of the mental and physical processes that serotonin is involved in. Now, to be clear, in a few minutes we'll jump into the actual mechanism that links too much serotonin with the symptoms of serotonin syndrome. For now, all you need to know is that the primary cause of serotonin syndrome is way too much serotonin. Okay, now for the symptoms of serotonin, we can divide them into three different categories: autonomic, neuromuscular, and cognitive. And right off the bat, we can guess that serotonin is normally involved with these general domains of our neurobiology. But the question remains of exactly how they're related. When it comes to neuromuscular issues in particular, the most common and mild symptoms are overactive reflexes and involuntary movements, especially in the legs and feet. This tells us that serotonin may have a positive role in reflex movements, perhaps facilitating their initiation within the spinal cord, because that's where reflexes begin. Now, a much more severe symptom in this domain is severe overall muscle rigidity, which again tells us that serotonin has something to do with the commands that nerves send to muscles to tell them to contract. Now, within the autonomic category, that is the category pertaining to the processes by which your brain controls unconscious bodily processes like heart rate, sweating, body temperature, digestion, and so on. Serotonin syndrome commonly causes nausea or diarrhea, excessive sweating, and elevated heart rate or blood pressure. And that tells us that serotonin may have a role in the hypothalamus. That's the brain's autonomic control center, but actually these symptoms don't tell us all that much. For example, the most serious autonomic symptom is severe hyperthermia, which is basically severe fever. And that is sometimes caused by rapid muscle contractions and spasms that generate heat, rather than always by the hypothalamus setting a too high set point on body temperature. So in other words, it's the friction, it's the movement of the contracting muscles rather than the brain purposely setting the body at a higher temperature. Okay, and finally, in the cognitive category, the mildest symptoms are typically insomnia and anxiety, whereas the most severe symptoms tend to be agitation, that is, an unpleasant state of high physiological excitement, as well as confusion and coma. Here we begin to see that serotonin may have a role in physiological arousal, sleep, or circadian rhythms, and other related processes. And indeed, we'll see in the next video that it does. Okay, so those are the symptoms of serotonin syndrome. And you can see that they tell us a little about what serotonin normally does in the brain. However, as with the muscle rigidity example, always remember that the particular symptoms may not indicate that serotonin has a direct role in the underlying process. It may instead only be tangentially related, with the symptom arising due to a more general problem rather than one specific to elevated serotonin per se. Anyway, what all this definitely does tell us is that serotonin is important for modulating a huge variety of functions in the brain and body. And this is a theme we will encounter throughout the rest of this mini-series. Okay, the biggest problem that doctors face when diagnosing a patient who they suspect has serotonin syndrome and is showing some of those symptoms we just mentioned is that it resembles other toxicological conditions, and there is no laboratory test that will unambiguously confirm a serotonin syndrome diagnosis. All right, that being the case, let's look at how doctors go about differentiating serotonin syndrome from a related condition called neuroleptic malignant syndrome. This will also lead us into talking about the different treatments doctors may use for these two syndromes. But before we get to that, let's look at the similarities between serotonin syndrome and NMS. Okay, first off, when it comes to vital signs, these conditions look almost identical. Both can cause hypertension, elevated heart rate, rapid breathing, and extreme fever or hyperthermia above 105 degrees Fahrenheit, which is 41 degrees Celsius. Both can also cause excessive salivation and sweating, as well as increased muscle tone, though in different muscle groups. Like as serotonin, as we mentioned, it's mostly in the lower extremities, whereas with NMS, it's throughout the body. And if left untreated, NMS or serotonin syndrome, if severe cases, can be fatal. So now let's turn back to the differences. The main difference between these syndromes is the causative agent. That is, the type of drug that can bring about one or the other. For serotonin syndrome, it is an overdose of drugs that cause an effective increase in the amount of serotonin available in the brain and body. For neuroleptic malignant syndrome, they're usually drugs that block the action of another neurotransmitter called dopamine. And those drugs, specifically the ones that block D2 dopamine receptors, are often used to treat psychotic symptoms in schizophrenia. And if you want an introduction to dopamine or dopamine and schizophrenia, check out my other videos in my playlist on dopamine. Okay, so the patient's drug history alone will help a lot in determining which syndrome they have, but there are also a few key differences in the diagnoses that would seal the deal. The difficult part is that not all of these differences will show up, and people tend to show different kinds of symptoms. However, serotonin syndrome develops fairly quickly, within about 12 to 24 hours of overdosing, whereas NMS takes from about 24 to 72 hours or sometimes even longer. Yet the time course of serotonin syndrome is partly dependent on the particular drug that caused it and how long that drug takes to metabolize, so whether it's a slow release or not, and how big the dose is. Some other differences are that serotonin syndrome can cause pupil dilation, but NMS usually doesn't. NMS can cause the skin to appear pale, but serotonin syndrome typically doesn't. Serotonin syndrome can increase digestive activity and thus the sounds coming from the bowels, but NMS usually does not. NMS causes what is called lead pipe rigidity throughout the body, meaning that the muscles are extremely stiff and hard to move, whereas serotonin syndrome may increase muscle tone only moderately and mainly in the legs and feet. And serotonin syndrome often causes overactive reflexes and muscle spasms in the lower extremities, but NMS usually reduces reflexes overall. There are also differences in the cognitive domain, where serotonin syndrome is more associated with agitation and anxiety, and NMS with stupor, eating less, and the inability to speak. Now, the treatments for each condition begin similarly, by the patient discontinuing their use of either the serotonin increasing or dopamine blocking drugs. And if the doctors are worried that there's a dangerously high amount of the drug still in your stomach and digestive system, they may actually give you activated charcoal. Yes, actual charcoal, which can help absorb some of the drug molecules before they cause further problems. For NMS, the next stage of treatment may be dopamine increasing drugs to compensate for the lowered signaling in the dopamine system, which is causing the NMS. For serotonin syndrome, on the other hand, the next step may be giving muscle relaxers or sedatives like benzodiazepines, which help turn down the activity of the nervous system by interacting with the GABA system. And if you want to learn more about that, check out the videos on GABA. But they basically turn down the activity of the nervous system in general, and then reduce serotonergic signaling along the way simply by turning down many of the neural circuits throughout the brain. In more extreme cases of serotonin syndrome, however, the doctor may also prescribe a drug that specifically blocks serotonin signaling as a kind of fail-safe. From this, it's clear that extremely high levels of serotonin are the culprit in serotonin syndrome. But how does that actually work? What's the mechanism? Let's turn to that question now and consider serotonin's role in the brain in general and in serotonin syndrome in particular. The most common type of antidepressant is the selective serotonin reuptake inhibitor, or SSRI, which, as its name implies, works on the serotonin system and effectively increases the amount of serotonin in the brain. Serotonin is a neurotransmitter molecule similar to dopamine, which means that it binds to receptors on neurons and influences those neurons to be either more or less likely to fire. And that means it is more or less likely to communicate with other neurons to which they are connected. If you need an introduction to neurons, neurotransmitters, or the process by which neurons communicate called synaptic transmission, or even how neurons fire, check out my earlier videos and playlists on those topics, which should be linked somewhere. All right, as we noted earlier, serotonin is involved in a huge variety of cognitive, neuromuscular, and homeostatic processes. Also, in the next video in this serotonin miniseries, we will directly address serotonin's functions in a much more comprehensive manner. We'll look at everything from the relevant brain regions, neurochemistry, and various cognitive and behavioral, and even motor functions associated with serotonin. However, here I will simply list some of the functions and quickly mention how serotonin may be involved. First, sleep. Serotonin seems to promote sleep by influencing the neural circuits in the hypothalamus and increasing what is called homeostatic sleep pressure. It also seems to be involved in circadian rhythms by, for example, the fact that the sleep hormone melatonin is actually a metabolite, a byproduct of serotonin breakdown. Serotonin is involved in mood and emotion, with one big line of evidence, of course, being the fact that the most common and most effective antidepressants work on the serotonin system, and that many of these same drugs are also used in treating anxiety disorders. Serotonin can also increase social dominance and helps define social hierarchies. We'll talk more about that in the next video. It's involved with brain development in utero, so for developing fetuses, and it may be involved in the development of autism spectrum disorder. Finally, serotonin is involved with eating behavior, possibly by increasing satiety signals, which are those that tell you when you're full and when you should stop eating. And that has something to do with a curious fact that often people who start SSRIs often lose weight initially and then gain weight later on. Again, that's something we'll be talking about in the next video. And again, this is just a smattering of what serotonin does in the brain. Serotonin has a role in the microbiome, and a lot of the serotonin in your body is actually produced in the gut. In fact, about 98% of it. And to make serotonin, the amino acid tryptophan, which you have to get by eating food since your cells can't make it, is chemically transformed within cells of the brain or gut to 5-HTP and then to 5-HT. Anyway, don't feel like you have to memorize the step-by-step synthesis mechanism or anything like that. All right, finally and importantly, serotonin has about 14 related but distinct receptors that it can bind to, each of which may have a different mechanism and which is found at different concentrations in various brain regions, organs, and even individual cell types. As you can see, serotonin's function is anything but simple. And now that you have an idea for how serotonin generally works, let's see what happens when you increase it to unnaturally high levels and how that leads to serotonin syndrome. To be clear, the mechanism behind serotonin syndrome in humans is not fully understood, but it's assumed to be very similar to that in rats. And they have been the animals used to study the syndrome, since many of the studies in humans would at this point be unethical. That is usually not a bad bet in medical science, so we'll go ahead and assume that at the level of cells and molecules, serotonin syndrome is pretty much the same for rats and for humans. Now, the main cause of serotonin syndrome, as we've mentioned, is dramatically increased levels of serotonin, but the precise blood concentration will differ from person to person. And that's something we'll return to when we discuss the genetic contributions that put you at greater risk of developing it. The most common way that this occurs is combining two or more drugs that effectively increase the level of serotonin in the brain and body. Now, the reality is that you might not actually be increasing the amount of serotonin in the brain overall, but you may be increasing it in the spaces between cells because you're actually releasing more from those cells or not letting as much to be taken up by those cells. So that's why I say an effective increase of serotonin, because it's really the amount of serotonin in the synapses between neurons, in the bloodstream, and in other spaces like that within the gut. Okay, now the combination of drugs is most likely to cause serotonin syndrome when there are two different complementary mechanisms at play when one multiplies another. So often it's the combo of an SSRI and something else, and an MAOI is the most potent. We'll talk about what that is in just a second. Okay, so to understand this, let's talk about how some of these drugs work. I've talked before about how drugs like SSRIs increase serotonin by blocking reuptake pumps, which are basically proteins on neurons that suck up any extra serotonin that's in the synapse. So they're basically regulating the amount of serotonin that is in that synapse by pulling it back into the sending neuron. Now that's why they're called selective serotonin reuptake inhibitors. But another class of antidepressants called tricyclic antidepressants, or TCAs, as well as certain opiates, the herbal supplement known as St. John's wort, as well as amphetamines and street drugs like MDMA and to some extent cocaine, these can all also block serotonin reuptake pumps to some extent. Not as potently as serotonin selective reuptake inhibitors, and some also do it on other neurotransmitter systems, but the point is that they are increasing serotonin to some extent. Other types of antidepressants have a similar effect with distinct mechanisms, such as the so-called monoamine oxidase inhibitors, or MAOIs, which instead block an enzyme called monoamine oxidase. Now, monoamine oxidase breaks down excess serotonin so the body can reuse it later. So MAOIs effectively increase serotonin by stopping the mechanism that breaks them down. Certain drugs, like lithium, can bind directly to serotonin receptors and thereby act as if they are themselves serotonin. Finally, more subtle mechanisms that involve the complicated biochemistry of serotonin can be involved when drugs affect those, such as those that interact with drug metabolism generally. So that covers some of the many ways that serotonin can come to be elevated in the brain and body. But can we get any more specific about why elevated serotonin leads to serotonin syndrome? Yes, a little. Before, I mentioned how serotonin has at least 14 subtypes of receptors. each with different effects and primary locations in the brain and body. And while many of these have been shown to contribute to the symptoms of serotonin syndrome, scientists have just begun to narrow down which receptor types are important for which particular symptoms, and which are most important for serotonin syndrome overall. For example, a study in rats showed that if the scientists induced serotonin syndrome by drastically increasing serotonin concentration, they could prevent the extreme fever known as hyperthermia and the resulting death of the rats simply by blocking a particular serotonin receptor subtype, the 5-HT2A receptor, but not by blocking the 5-HT1A receptor. So it would appear that hyperthermia, that's characteristic of serotonin syndrome, may be caused by pathways in which 5-HT2A is heavily involved. They also found that this same intervention could stop some of the unusual activity in the hypothalamus that may have caused the elevated body temperature. Now, that's pretty interesting if you ask me, but it's a far cry from fully elucidating the mechanism, even just the mechanism behind the single symptom the researchers looked at, hyperthermia and resulting death. There are still at least 12 other subtypes that may or may not play some role in serotonin syndrome, not to mention the fact that 5-HT2A receptors may even have more roles that have not yet been investigated. So, as they say, more research is needed. All right, up to this point, we have discussed the causes and consequences of serotonin syndrome. We've talked about some of the drugs that increase your risk and the fact that combining serotonin-increasing drugs is not a good idea for that reason. But we have not talked about how compounds that you might not think of as serotonin increasing, some of which are available over the counter, can increase your risk as well. To help you avoid a case of serotonin syndrome, I'm going to list off some conditions and compounds that may be prescribed or otherwise taken by people experiencing those conditions. As we just talked about, depression and anxiety disorders are the most obvious conditions that would predispose you to serotonin syndrome, since they are often treated with SSRIs or other serotonin-increasing drugs. Mixing SSRIs and MAOIs is especially likely to cause serotonin syndrome, but as the vignette from earlier illustrates, it can also happen with street drugs. Now, the reason that SSRIs and MAOIs combined are especially likely to cause serotonin syndrome is in the fact that while SSRIs are blocking the reuptake of serotonin into the synapse, the MAOIs are breaking down the enzymes that would otherwise break up those existing serotonin molecules. So what you get is this multiplying effect where there's tons of serotonin left in the synapse in the brain, and there's really no way to suck it up, to break it down, to get rid of it. So it is just going crazy. So anyway, any disease that can cause or increase depression or anxiety disorders could be associated with serotonin syndrome simply due to the fact that these patients would be perhaps prescribed antidepressants. Interestingly, severe infections that are treated with an uncommon antibiotic called linezolid can place you at greater risk for the simple reason that linezolid is actually an MAOI. And I think I'm saying linezolid wrong, but someone please feel free to correct me. And even certain painkillers can increase the risk of developing serotonin syndrome. Those include prescription opioids like oxycodone, fentanyl, tramadol, as well as dextromethorphan, and that is actually a very common ingredient in the over-the-counter cough syrups like NyQuil and Robitussin. So even if you're just taking cough syrup, you should be careful about it if you're also taking an SSRI or some other drug that might increase serotonin. These drugs can obviously be dangerous on their own as they're highly addictive, and especially with fentanyl, are prone to causing fatal overdoses. And when they're combined with an SSRI, they can increase the risk of serotonin syndrome. Okay, moving on. Some antiretroviral drugs that are used to treat HIV may also present some risk by interacting with enzymes that break down SSRIs themselves and other drugs, making those enzymes less efficient at doing so. So this time, it's not the enzymes that are breaking down serotonin, but the ones that are breaking down the SSRIs. And this is a problem because people with HIV are often prescribed antidepressants for depression or anxiety, as that is understandably a common side effect of being diagnosed with HIV. Finally, while I certainly haven't covered all the compounds that may increase the risk of serotonin syndrome, the last one I want to mention is the herb known as St. John's wort. This is an herbal remedy that many people use as a home remedy for depression. And there's actually pretty solid scientific evidence that it can be nearly as effective as some SSRIs for for mild to moderate depression. Though it's not like it's accepted by the FDA for treatment of depression, so there's still a way to go on that. Now, St. John's wort has multiple active ingredients, and it appears that it works to increase serotonin signaling through multiple mechanisms. No surprise then that St. John's wort can increase the risk of serotonin syndrome in people also taking SSRIs or other serotonin drugs. Okay, lastly, I just wanted to say that if you're taking any drugs for depression or really anything else, ask your doctor before you decide to start taking anything. If you absolutely can't do that for some weird reason, then at least get the very best information you can about what interactions those drugs may undergo and whether taking them at the same time places you at risk of developing serotonin syndrome or another unfortunate similar condition. Because you really do not want to find out the hard way. All right, thank you so much for watching this video. I'm really excited for the next videos in this series, in the serotonin mini-series. I've been learning a lot, and I'm just excited to share all this with you. Now, before I go, I want to ask a special request of you. If you enjoy this channel, if you've been watching it for a while and you like it, please consider signing up for the newsletter. Now that link is going to be in the caption below, but it's also on our website at senseofmindshow.com/newsletter. This newsletter is, it has exclusive videos. So these are videos that are exclusive to the newsletter that only newsletter subscribers can watch. And they contain, always have 5 different elements, which is a section about the human brain or mind and some fascinating fact about that, a book review or recommendation or suggestion of something that I've been reading, an interesting or inspiring quote, my thoughts about life, culture, and current events, and a science-based productivity or happiness tip. So those 5 things together, I really think that they're going to provide value, and I usually try to keep that video under 30 minutes, and I think we'll shoot for even shorter on that. But if that's at all interesting to you, just know that the newsletter is always free. I do not advertise on there for anyone else. I'll never sell your information to third parties or anything like that. I won't spam you. I won't give the email list to anyone else. So just know your information is secure, and I would love to be able to connect with you more there. So please consider signing up for that. Make sure to also follow this page, subscribe to the YouTube channel, like, comment, share. It's all really helpful. Thank you so much for watching. This channel is brought to you by the Diamond Mind Foundation, and this video was written and produced by me, Andrew Cooper-Sansone. Thank you so much for watching. I'll catch you next time.